Hey, it's Tim from Fiix Body, and I want to walk you through your first 5-minute therapy session. So grab your Fiix Elbow and let's do this together. The Therapy Cards app and the weekly emails will be great tools to use throughout the 8 weeks. The key to pain relief is following the program, both the therapy robot and the daily exercises. The robot or stretching alone won't fix chronic tendon pain. Let's start with the robot. The robot itself is very simple. On the bottom side, you'll notice an on-off button, and then on the top side, you'll notice 3 buttons. The play button, which starts the robot, the stop button, and the time button, which adjusts the time period. The first treatment is 5 minutes, then everything else is 10 minutes. Now let's talk about golfer's elbow placement with the Fiix Elbow robot. Now the first thing I want you to do is I want you to locate the bony protrusion on the inside of your arm. This is the medial epicondyle. You can see I drew a red circle around the bone itself, and this is where that tendon attaches. And you can see this blue line that I drew on my arm. Now this shows that where that tendon and muscle path is. The tendon itself is only about 1.5 inches to 2 inches long. Now that's where that scar tissue is, so that's the area that we really want to be working. Now the challenge with golfer's elbow is that this bone can protrude, and so does the forearm, so that means that tendon is recessed in here. Now to get the robot, this is the internal drive mechanism from the Fiix Elbow robot. And what I want is this stainless steel scraping blade right here. As this comes around the pulley, I want that to engage just after that bone. So what we're gonna do, and I'm gonna exaggerate it a little bit here, but I want that robot angle to be a little bit like this, so you can see there's space at the top between my forearm and the machine, because we're really just working that 1.5 to 2 inch area. The other thing to think about is if we strap the robot down, if you tighten the strap around your arm, what it's gonna do is it's gonna work the forearm muscles instead of the tendon. And now that's still good, it can still help, but if we focus on this area to break up that scar tissue, it's more effective. So in order to do it, what I like to do is I grab a pillow. You can also use the arm on a couch. I've done it laying down on my bed where I have my arm to the side, but the most effective way for me personally is to get a pillow, put it in my lap, and I turn the robot upside down. So before you put your arm in here, you're gonna use the emollient. This emollient, you put just a little bit on your arm. You're gonna take a little bit and you're gonna work it around this entire area here where you're gonna be massaging. Now the purpose of this emollient is it reduces friction, so it makes it glide a little smoother along your arm. There's also a little menthol for a cooling effect, so that helps as well. Now, in order to get started, what I want you to do is to turn the on switch on the bottom, and then from there, you're gonna hit the play button. I also have this strap so that it's loose, so that I can slide my arm in and out. Now what I do is I slide my arm in and I'll actually start on the forearm muscle, and then from there I can work my arm in further so that I can get it close to that bone without hitting the bone. That's number 1. Number 2, what I do is I push down, I apply the tension and the intensity by pushing down on my elbow, and I actually lift up in the front here a little bit, so I have a little bit of space from my forearm and the front of the robot. And that's getting that focused area in that first 1.5 or 2 inches. Now the next thing you can do for intensity, what I like to do is I make a fist, and then you can manipulate your wrist. You can rotate your wrist, you can go into flexion, you can go into extension. And what that does is it flexes that tendon and muscle wad, which will increase the intensity. So now when I do this, I'll squeeze my hand, I'll manipulate my wrist, and I'll hold that for about 30 seconds so that it gets a little deeper in there. And then from there, I'll release for about 30 seconds, and then I'll go back and forth with that routine, 30 seconds intense, 30 seconds easier. Another thing I'll do, and I'll swing this around so you can see, I'll rotate my arm a little bit, and I'm exaggerating it here a little, but I like to rotate my arm within that machine, and that works a broader area in here. Now, it's really not that specific. The scraping blade itself is 1 inch wide, so it covers the area, but it allows you to get into a bigger space in there. A couple things to note during therapy, you might experience a little bruising after your first couple treatments. That's totally normal. It happens in a physical therapy clinic. Some people bruise more than others, but it typically dissipates within a day or 2. Another thing you might notice is an increase in pain. Now you don't want to go too intense, but an increase in pain is actually a good sign. That's telling us that you're breaking up scar tissue and adhesions. That means that the blood flow has started to recruit, so then the healing will start. We have a lot of customers that want to speed this up, so they use it every day, or they'll go 20 minutes, which really overdoes it. It's just a tendon, it's not like a large muscle. So follow that protocol, and if you have any questions, give one of our elbow coaches a call. All right, now I'm going to walk you through the stretching exercises, a critical component of the Fiix Elbow program. The first 4 weeks, the breakdown phase, only incorporates stretching exercises. At week 5, you'll receive an email and app notifications to walk you through our strength exercises. This information is also available on the therapy cards in the case. Think of stretching as pliability. We want your tendon to stretch and not tear. Stretching alone won't fix chronic tennis or golfer's elbow. It's the combination of scraping and exercises that are proven to fix the damaged tendon. For the stretching, we boil it down to the 2 most effective moves. Now, if you have golfer's elbow, it's the wrist extension stretch. So you're gonna put your arm out and you're gonna rotate your palm up, and then with your opposite hand, you're gonna pull back. Now with this one, you can pull your fingers in a little bit, and that'll create a little additional stretch across the inside of the elbow. The second stretch works for both tennis elbow and golfer's elbow. It's the wrist flexion and extension, or the door knocker. So what you're gonna do for this is you're gonna put your arm out and you're gonna rotate your wrist in and out, and you're gonna do 15 reps of that, and then you'll do 2 sets of this exercise. We recommend that you stretch at least 2 times a day, but you can stretch up to 4 times, and you're gonna stretch 6 to 7 days a week. Customers often ask us, is there a best time to stretch? While it's most important to do the stretches, we do have a few tips. You're probably already doing this, but stretching before activity makes a lot of sense. It makes those tendons warm and pliable before you stress them. It's also smart to stretch 1 to 2 hours after activity. This elongates that tendon as it heals. If you have pain while you sleep or you're sore in the morning, it's a good idea to stretch before you go to bed. And related to this, you should wait at least 30 minutes before you do your first stretch in the morning. We want your body to warm up. We want the blood flowing before you go into a stretch. Another thing to consider is working stretches in your everyday activities, like watching TV, a phone call, or brushing your teeth. It's like killing 2 birds with 1 stone. Remember, it's more important to stretch than when to stretch, and the notifications on the app will make sure you don't forget. If you have any questions with the Fiix Elbow program, feel free to reach out to one of our elbow coaches.